Hey everybody, welcome back to another whiteboard chat, and today we are going to talk about proton pump inhibitors and acid reflux and kind of take these two things and put it in a nice, easily digestible package. Pun intended there. So, what is a proton pump inhibitor? Well, proton pump inhibitor is, just as the name suggests, it's inhibiting the proton pump. Essentially what they're doing is shutting down the acid production from the parietal cells in the GI tract. These cells reside on the surface and they're essentially producing acid in response to food ingestion. Especially protein ingestion. We need HCl for protein primarily, and just a bolus of food that comes in. So it's essentially slowing this process down, and PPIs are thought to manage, I'm not going to say cure, but manage acid reflux or GERD symptoms. Now, for a lot of you watching, you probably already know that many cases perhaps are low acid and not high acid. The thought process is that the low acid can potentially cause some intra-abdominal pressure. We see that this process of peristalsis, or these muscles that are kind of contracting and moving things through the GI tract, it'll be heightened, right? So we cause some additional intra-abdominal pressure. That pressure may perhaps pop open that esophageal flap that we have here in our esophagus, and then we get splash up. Manifests itself in different ways too. It doesn't necessarily have to be full-blown acid reflux. We can also see things like excessive burping all the time, belching with meals or even in between meals. So that pressure can come up even without the acid being present, and that's really still GERD at the end of the day, when we're seeing that in excess. Proton pump inhibitors do seem to help with that intra-abdominal pressure, so we do see some relief of acid reflux oftentimes when they're initiated in that management process, or they're prescribed. But what we see over time is that they generally work less and less and less, and you need prescribed more and more and more, or stronger versions, or even people taking multiple antacid medications at a time, so PPIs, H2 blockers, different classes and in combination, and it never really cures anything. The problem here is that there's a lot of side effects long term. So not only are we potentially making the issue worse by continuing to lower acid levels more and more and more, we are also running into a lot of potential side effects in the long run. Not only are we putting ourselves at risk for things like nutrient malabsorption, there's some literature that actually suggests this, seeing deficiencies in things like magnesium or calcium or B12 or whatever it might be. A lot of that's just a result of poor nutrient absorption because we're continuing to suppress that acid secretion down more and more and more when it was already low to begin with, perhaps, right? Next up, we do see some potential for cognitive decline. There's some literature that may suggest, and some of these things aren't completely conclusive, you're going to see different opinions, may suggest contributions to age-related cognitive decline like dementia, Alzheimer's, right? Not good. We also see issues with other gastrointestinal issues, mainly SIBO or small intestine bacterial overgrowth. Now, we keep in mind that when we continue to suppress this acid down more and more and more, we're essentially having things sit in there. They're not digesting well, they're not breaking down, and they're moving through the digestive tract very slow, very poorly, or once they're emptied into the intestinal tract, they're not really broken down to the way they should be. We're getting extra fermentation, and we're getting bacterial overgrowth of that opportunistic bacteria, which usually turns into SIBO, right? And that's why we most commonly see acid reflux in combination with other GI issues, at least if the reflux has been there for long periods of time, or the GERD, I should say. Other things PPIs can be prescribed for are H. pylori. That's very common. You see the typical combination therapy of PPIs and antibiotics with H. pylori. There's some merit there, right? Like the thought process with this is that the H. pylori will die off a little bit better in a lower acid environment, and then the antibiotics themselves will take care of the actual active infection. That's not to say that route doesn't work. It does usually work, but we oftentimes see a lot of rebound issues afterwards when coming off of the antibiotics, when coming off the PPIs, or they never come off the PPIs. They're told to stay on them forever, long term, right? So as you can see, when we look at these issues, it's really kind of a dead end road when we're going down the route of PPIs. So how can we work on these things? Well, there's a few things. One is we should understand why we're having low acid issues, or I should say insufficient acid issues in the first place, because keep in mind that just because you're having GERD symptoms doesn't necessarily mean that you have low acid. It just may mean that your demand for acid is higher than what you're able to produce, i.e. eating extreme amounts of protein, perhaps, right? So one is lowering protein intake can be super effective, and it can be a very quick way to alleviate a lot of these symptoms. People, especially those that overeat protein, that are eating 350, 400 plus grams of protein, when really they would probably get maximal muscle protein synthesis with 25% less protein perhaps. So that's a really easy way to lower those acid demands pretty quickly. Two is, if there is an active H. pylori infection, that will potentially cause acid secretion to go down a bit. So working on that through use of specific supplementation and perhaps lowering protein intake can be beneficial. We can also implement things like apple cider vinegar as a baseline. That seems to help, although there's some there's some esophageal and tooth enamel risks there. So a lot of people like to dilute it, use the straw, take it in small amounts, all that stuff to kind of ward off some of those issues. We can introduce HCl itself, which is betaine HCl. That's pretty effective, right? We know we can introduce that in varying amounts. Perhaps we're starting low and titrating up on that and meeting those acid demands. But ultimately, none of those things outside of maybe I'm not going to say curing, outside of maybe getting the H. pylori out of the way, is really a permanent solution. We really have to ask ourselves why we have the low acid production in the first place, and of course work from the root like we would always do. Just as a recap here, the PPIs are proton pump inhibitors that are lowering the action of the acid secretion from the parietal cells. They're often prescribed for acid reflux or GERD, even though we know a lot of the time that GERD is potentially a low acid issue. You can do something like a baking soda test for that. It's relatively accurate. If you're having these issues chronically and other side effects like loose stools, especially reactive loose stools to meals, lots of belching, things like that, you might want to get a GI map or get an H. pylori test of some kind to check for that. And from there, once you can kind of figure out what's potentially causing the GERD issues in the first place, we can make some adjustments, whether it be dietary, supplementary, or otherwise. So hopefully that is helpful in kind of helping you understand what PPIs are and what they do and what could potentially be causing reflux. It can be a pretty debilitating issue for people, and it can be pretty daunting. And I know that coming off of PPIs is very scary for people oftentimes. And there is a little bit of a lag period. They have a pretty short half-life, pretty short active life. They'll clear relatively quick, and those parietal cells come back online pretty quickly, but it's not always an instantaneous process, so it's a little uncomfortable for people sometimes. But hopefully this sheds some light on that, and we'll talk to you guys next time.